Some of the issues that we've had at the unit that I work in have been influenced by the research that Salford has done, particularly with improving the amount of breast tissue on the image receptor, with image blurring, with practitioner compression variability. So about 6 years ago we had a big issue with image blur, and Salford's research helped us to work out what was involved in that blur and looking at the different use of paddles, and that led to a reduction in our technical recall rate, which ultimately led to a reduction in anxiety for the patient who didn't need to be called back. Since then, our technical recall and repeat rates are now within the national standards. There was variability in the technique that mammographers used, and there was no evidence to demonstrate. The research that Salford did demonstrated that by increasing the image receptor height by around 2 centimetres led to an increase in the amount of area imaged on the image receptor, and that meant that the compression on the breast was improved. And in theory that means that the cancer detection rate could also be improved, so it did have a massive impact. So we adopted this technique about 3 years ago, and we screen in the region of 30 to 40,000 patients every year. So it's had a huge impact, which hopefully will have increased our cancer detection rates. So this book has been particularly useful. It's got lots of examples of research in there from Salford and some of the changes in clinical technique.